My name is Kwame Yabwa. Today you're here with ASHAN TV. Kindly subscribe to my YouTube channel and also share my videos. If today is your first day stumbling on ASHAN, subscribe. Make sure you subscribe and also click on the notification bell or hit the notification bell so every time I bring up any video you'll not miss it. This video that you're actually watching right now, I will let you watch the video in full. But right now, what you're seeing at the background is a protest. A protest, not just any ordinary protest. It's a protest of doctors, nurses in the UK protesting against the vaccines that they've been injecting people. Okay, let me just repeat. Doctors in the UK and the nurses are protesting against the vaccinating or forcefully vaccinating people. They're actually rejecting against. But I just want you to hold this thought for a little bit. Let's just cast our mind back on what has actually gone down on number 10 Downing Street. Boris Johnson, the Prime Minister of United Kingdom, he's a leader, and a leader that is supposed to set an example as a leader. I just want you guys to remember during the lockdown period, people couldn't even go and visit their own families. People were dying without their family being there because the government has told people to stay away from each other and then lock yourself in your own home. That is what the leader of the United Kingdom instructed the whole country. It's not even the whole country, it's actually the whole world as such. But doing that, the leader was partying in number 10 Downing Street. He was partying, doing party. But anyway, just a side thing. The same leader has also set a rules based on unvaccinated people will lose their job coming April. Unvaccinated people in the UK are going to lose their jobs during the April. So this protest that you're looking at now, these protests are the nurses that are protesting against number 10 Downing Street, telling the government or telling Boris Johnson to stop what they are doing because vaccinating, it is not by force. You cannot force people to inject themselves if they want to. But the question is, if the nurses and the doctors are even saying something that they don't want to vaccinate themselves, then it raises a question mark. If the Prime Minister as a leader who tell people to stay on a lockdown is partying, then it also raised a question mark. So this is where we are now. Remember, during the COVID-19, a lot of people died because there was shortage of nurses and everything in the United Kingdom, and even they started inviting people from ASHAN, nurses from ASHAN, to come to the UK to actually help. Right now, the COVID-19 disease is settling. Recently, Boris Johnson has also come up and said that he also all the restrictions relating to the COVID-19, now he's going to strike all those things out. Right. So he is going to strike those restrictions out, meaning that COVID-19 has settled or has been a bit mild compared to when it first surfaced. So now the nurses are saying, the doctors are saying, they don't believe that they have to be vaccinated. They have to be forcefully be vaccinated. And the government is also saying that they have to vaccinate themselves because if they don't, they're going to put other patients at risk. And they are also saying that when the COVID-19 surfaced, the day the COVID-19 surfaced very, very hard in this country, the nurses were on the front line fighting and saving lives. So why is the government telling them now that if they don't vaccinate themselves, they are going to infect people? And the question is, if somebody has already vaccinated, why would the nurses and the doctors affect them anyway? So what the nurses are saying that they are not against any vaccination or anything like that, or they are not against people who wants to vaccinate themselves, but they themselves, they are not vaccinated. For me, I'm sitting here now, I'm thinking, if the nurses and the doctors are saying that they don't want to vaccinate themselves, then I need to ask myself a question. But anyway, so this is what is actually going on in the UK. The government is actually really playing hard to get. The government is actually really stamping on this, putting a stamp on it and say, you know what, during April, if all the nurses and the doctors don't vaccinate, then of course they will lose their job. Meaning that there's going to be a lot of pressure on the NHS because you guys don't have nurses and doctors already. You don't have nurses and doctors already. You even going to other countries and bringing nurses here in this country. But now you want to get rid of your own nurses, special nurses that you have in your own country. You want to get rid of them because they don't want to vaccinate. And the question is, why don't they want to vaccinate themselves? Meaning that they don't trust it, because they are saying that if you're going to vaccinate me, you should do something. But if I'm going to put vaccine in my system and it's not going to do anything, then it's not going to prevent me from getting COVID-19. Then what's the point? That's what the nurses are saying also. We're not even talking about outside people. People who, when I say outside people, ordinary people. The nurses are saying that the nurses and the doctors are saying they're not going to do it. How much more the outside people who are not the nurses and everything? And I'm sure what the nurses are doing has also inspired other people, and other people are also not going to do it more, because they are saying that nurses and doctors even are afraid of this vaccine. Then how much more an ordinary person? Anyway, let's go ahead and just watch this video in full, and so that you get clarity of what is going down, what is really going down. Once again, my name is Kwame Yaboa, and if today is your first day stumbling into ASHAN TV, please kindly subscribe to the channel, and do not forget also to click on the bell. Okay, thank you.
Rallies have become regular events around the country, but this one in London had a difference. Among the crowds, significant numbers of NHS staff opposed to government plans to force them to have a jab or risk losing their job. Freedom! Up to 70,000 NHS workers remain unvaccinated. Those attending today defiant about their right to choose.
I will lose my job, and I'm happy for that, because I believe in, the principles of why we're all here.
Which is it's choice, effectively.
It's informed choice.
We're not going to be bullied or coerced into having something we don't want.
As it stands, all health and social care staff must be doubly vaccinated by the start of April, meaning that they need to have their first dose by the 3rd of February to meet this deadline. It's believed 70,000 or more staff could lose their jobs, as NHS leaders again appeal for them to get jabbed.
If you're marching today, just take a moment, think about the people that you've been looking after who have experienced COVID. Think about your colleagues who you've been working with, and think about the best way to make sure that we're all protected and that we're all as safe as possible, because we are very much in this together.
Ever more creative ways of encouraging people to get a jab are now being rolled out. This jab and kebab offer in Kent is designed to reach people who've so far opted not to go to a vaccination centre. Those administering the vaccines here think it's the duty of all medical staff to be jabbed.
I think it's very important, if you're in a frontline role, then you are vaccinated. You need to minimise the risk of passing that on to vulnerable people. You could be carrying the virus and not know it.
The government has pushed back on reports suggesting it's planning to postpone its vaccine mandate for NHS staff. In a statement today, it said ensuring staff are vaccinated is the right thing to do to ensure patients and those in care are protected. A spokesman added at present there are no plans to change the implementation date of this policy. It would seem to put the government on a direct collision course with tens of thousands of NHS workers who appear to be willing to lose their job rather than have the vaccine, putting further pressure on a health service already struggling with chronic staff shortages. Dan Rivers, ITV News. Rallies have become regular events around the country, but this one in London had a difference. Among the crowds, significant numbers